Now we'll talk about another type of bone biopsy. This is more of like a site for bone biopsy. We'll talk about the site and also talk about reasons why you might actually need to pick up a biopsy from this site. So this is what is known as a transiliac crest biopsy. Transiliac crest biopsy. So for the transiliac crest biopsy, this is it. Taking a biopsy from across the iliac crest. Okay. So for the transiliac crest biopsy, you see that it's a medical procedure that is used to obtain a sample of bone tissue from the iliac crest. Okay, that's the upper border of the pelvic bone. Okay, and they use this for diagnostic reasons. So it's one of the most common sites that is chosen because the iliac crest is easily accessible. It's very safe and provides a lot of bone marrow, for analysis. So you might use it to diagnose bone disorders like osteoporosis, osteomalacia, Paget's disease. You can use it to also diagnose all those blood-related issues like leukemia, lymphoma, myeloma, and also you can use it to investigate all those bone pains and metabolic disease that you can't really explain why, So site, we say that the posterior iliac crest is the most often used site. It's often used because it's thick, it's safe, and away from major blood vessels. Alright. Sometimes the anterior iliac crest is what's chosen, depending on the patient's positioning and also what the surgeon prefers. So procedure is usually done under local anesthesia. Alright, and the special biopsy needle, also known as a Jamshidi needle, is big. Okay, it's a core. So the core bone tissue is removed for histological examination. So sample will now be analyzed under a microscope to access the bone structure. So advantages is to provide what bone marrow, aspirate, and bone biopsy. Okay, for the procedure. So complications could lead to pain, could lead to bleedings, could lead to infections, could lead to hematoma if not done properly.